Everybody, I'm Tish Hevel, and I run the Brain Donor Project, which is a nonprofit that supports the NIH's Neurobiobank as its contracted communication and outreach partner. So here's the plan for today. First, we're going to talk about brain donation, how to do it, and why it's more critical now than ever. Then we'll hear from a scientist who will present her findings on Black Americans and their attitudes about brain donation. Third, for those of us faced with urgency in our advocacy, but learning that relationships need to be built over time, some possible solutions. And finally, questions, put them in the Q&A or put them in the chat. So there's one big, fat, glaring problem with brain donation, and that is that not enough people know about it, or they have misconceptions. And the biggest one is that if you've checked the box to be an organ donor, it includes brain donation. It does not. You need to make separate arrangements. Or if you've already planned to become a body donor, that's the same thing. It also isn't. The brain is much more valuable for neuroscience research than it is for anatomic study, or that only diseased brains are needed. That couldn't be more wrong. Healthy brains or controls are at least as valuable and critical for comparative science. Brain donation is also not disfiguring. An open casket is still an option. And when donating to the brain banks in the NIH, there's no cost to the family. But here's why it's gotten urgent. So 1 in 5 of us now has a neurologic disorder, and our chances of being diagnosed with one increase as we age. So since we're all living longer than ever, you can see where this is headed. Also, shortages of tissue could slow research for certain brain areas and specific diseases. And if you combine that with there's not enough donated tissue from communities of color, the science is just not incomplete. And finally, this all comes at a time when there's going to be a significant amount of non-disease tissue needed for a major part of the Brain Initiative study. So good reasons why we need to look at this urgently. I should let you know how we learned all this. Let's just say the hard way. Meet my dad. When he was diagnosed with Lewy bodies dementia, we made arrangements for him to donate his brain, even though it was super complicated. So we talked to a lot of people about it, and I decided that I wanted to try to help make it a little smoother. So we started the Brain Donor Project 7 years ago. Right away, we realized 2 benefits. One is that there is a powerful sense of comfort, knowing something positive will come from this. And the other is illustrated by this slide. This is an enhanced histology image of my dad's brain that I'm told it confirms his diagnosis by making evident the dark purple spots that are the hallmark protein of Lewy bodies dementia. So this is how we got confirmation of his diagnosis. And once we understand more about the genetic underpinnings of a lot of these neurodegenerative diseases, that's going to be important information for his family to have. So after all that, the Brain Donor Project was formed to help out with the Neurobiobank. And there are 6 locations, UCLA, Mount Sinai in New York, Harvard, the University of Maryland, and the University of Miami. The 6th one is in Pittsburgh, and it just works with the ME's office. So even though they're like kind of spaced around the edges, be aware that they can recover from anywhere in the US. Okay, so a little background on the Neurobiobank. The NIH had just gotten into the brain banking business before we donated my dad's brain, because neuroscience researchers were having trouble getting access to the tissue from brain banks that were sort of privately run. So this is the nation's only federated network of brain banks. It serves academia and industry around the world. About 1/3 of what they ship is internationally. It accepts diseased and healthy brains, or so-called unaffected controls. For researchers, this is an incredible resource. They go to the website, enter their credentials for access to the portal, and then the details of their study. And then they consider what they need from the more than 15,000 subjects. So name a disorder, age-matched controls, they request what they need, they get an answer usually in about 48 hours, and they only pay for shipping. So it is a fantastic resource, as I said. For the Brain Donor Project, the focus is on simplifying the process for brain donation and also raising aware of the critical need for it. And a visit to our website is what gets things started. So it's all kinds of info, a robust Q&A session, a robust FAQ section, and then there's a brain pre-registration button in the upper right-hand corner, and that's how it gets things started for the pre-registration part of things. So then, once you've completed the form, we take the information and we determine which of the brain banks makes the most sense for that person. In a perfect world, if death is not imminent, we send the brain bank's registration forms. We do that either by email or snail mail, whatever the person wants. And then we effectively kind of hand off the relationship to that brain bank, which then explains what will happen at time of death. That is when the family plays a critical role. So the brain bank asks to be notified really fast, like ideally within an hour of death. And then the brain bank arranges to transport the body. Typically the procedure's happening at the family's funeral home these days. So the brain bank sends a pathologist or recovery specialist there. They remove the brain through the back of the head and then ship it using special expedited means to the brain bank to save it there. And then the body is released to the family for whatever funeral or cremation plans they may have. It doesn't slow any of that down. So to give you an idea of who is signing up or pre-registering to become a brain donor, there are more than 18,000 people now who have done that. About 40% are controls, which is good. They run the gamut of ages, they run the gamut of states, and there's more than about 200 categories of neurologic disorders. So most of what we do to get the word out is partnering with patient advocacy groups to help provide content to their communities and their stakeholders. We also work with end-of-life professionals, neuroscience nurses, hospice people to educate their communities. And when we're lucky, we land some significant exposure and earned media, like this National Geographic feature in 2018. And then last year we were on NPR Science Friday, which aired on 400 radio stations across the country. That helped a lot too. Shortly after that, in March of 22, we co-hosted a briefing of the Congressional Neuroscience Caucus. And after that, the Neuroscience Caucus co-chair, Earl Blumenauer, introduced House Resolution 1069 to name May 7th National Brain Donation Awareness Day. I got to pick the day, happens to be my dad's birthday, so that's why we picked it. There's a new Congress now, and so there is a new co-leader of the caucus, and they are working to reintroduce that bill very soon as we speak. So what I'm asking some of our advocate partners on here today to do is help us amplify this message. There is a toolkit link on our website. If you can help with that, that would be fantastic. And anybody who wants to also can sign up for our newsletter, which is also on the front page of the site. So our ask is for people to consider brain donation, to consider it as part of your legacy. Many of us give a whole lot of thought to our stuff and our money, if there's any left, and where we'd like that to go. So remember that you are in a position to give a really particular gift. So please consider brain donation and register in advance. Talk to your family about it because they're the ones that will see your wishes through. So the reason we're here today is that information I just presented needs to get out far and wide, as well as targeted, especially specifically to communities of color. So next, I would like to introduce our next speaker, Dr. Allison Caban Holt is the Associate Director of the Maya Angelou Center for Health Equity at Wake Forest School of Medicine. And she'll present her findings on attitudes and beliefs about brain donation among Black Americans. She's also working to create a rigorous program of research around community engagement of underrepresented groups so that the successes in recruitment in special populations can be documented and shared. Dr. Caban Holt, it's yours.
Thank you, Tish, and thank you for this opportunity to share with everyone about brain donation with regard to Black Americans. I have been here at Wake Forest about 3.5 years, but prior to that, I was at the University of Kentucky at their Alzheimer's Disease Research Center. And in the various places I've been, brain donation amongst Black Americans has been low. So we decided that we wanted to do some research on that because we do want to get those numbers up. So let me move my cursor so I can. So the purpose of the study that we did was to gain insights about the attitudes of Black community members toward brain donation and their perceptions of medical research that may hinder or facilitate brain donation. So I think we have to go to the community itself and ask them why, what are some of the barriers? I think we can't presume because we haven't been doing a great job so far of being inclusive for certain populations. And why is the perspective of this particular group so important for Alzheimer's disease? Well, prior research in Alzheimer's and other dementia shows that Black Americans are twice as likely to develop Alzheimer's disease than non-Hispanic whites. So we're at a higher risk. However, Black Americans are incredibly underrepresented in Alzheimer's disease brain donation research, making up only about 4% of the brain donations at the National Alzheimer's Coordinating Center, also called NAC. So while we are overrepresented in the disease, we're underrepresented in the research and in the brain donation. And, honestly, this low representation of African Americans in research, of Black Americans in research, this is across a number of research studies. This just happens to be one that I think is so striking because of how prevalent the disease is in Black Americans. We need to know more about how to move that needle on Black American brain donations. And we decided to do some community engaged research to get information from those who want to include. A number of studies that I've looked at before have requested information about brain donation attitudes from Black Americans, but it's often people who are already engaged in research. Those aren't the people that you necessarily need to engage because it's like preaching to the choir. They already are familiar and are comfortable participating in research. We've really got to go past that and get to the other 96% of people who are not donating their brains. So what did we do? So we did a survey. We had a 35-item survey about Alzheimer's disease knowledge and brain donation research perceptions. And I'll show you the references at the end. The items were selected from surveys, from prior research investigations, looking at personal motivations, perceptions of research and knowledge of brain donation procedures with a particular focus on questionnaires and questions that had been used with Black Americans previously. So the surveys were disseminated both electronically, people could use a QR code and complete the survey. And we also had pen and paper for certain outreach events that we went to. We had 4 sites in Florida, New York, North Carolina, where I am, and Ohio, and we collected them in between November of 21 and July of 22. And the surveys were collected during outreach events in each area. So this might be faith-based health fairs, community outreach events. We really wanted to get to the community. So for example, one that we attended was something called Christmas for the City. And it's literally a citywide event where anyone can come and just enjoy, the holiday season. And we got about probably 70 or 80 questionnaires, surveys completed just at that one event. The participants were provided a $25 gift card after survey completion, and the survey was approved at the IRB for each institution. So some of the results. The racial composition of the respondents is primarily self-identified as Black. So of course, again, we were out in different community settings. So sometimes, there were people who were not Black or that might have taken a survey. We had 81% non-Hispanic, 82%, 87% born in the United States. This is an issue that we have probably in every kind of research, is it was very predominantly female sample. So that's something that we definitely need to address. Birth years ranging from 1936 to 2003, and about half of the sample was born in 1970 or after. So it was a little bit of a youngish population. But those folks are important for Alzheimer's disease as well, because they may be the caregivers or maybe the ones identifying the next, identifying patients as difficulties. So, and I am probably going to overwhelm you just a little bit with a bunch of data. So just bear with me. I promise I'm going to break it down. So what we did was we asked people, if you look on the right, about the likelihood of them donating their brain after death. And then we asked them certain questions, whether they thought things were false, true or false. So basically, we asked, does society need to devote more resources to medical research? And then you can see that people who, were likely to donate, or suggest that they're likely to donate, or are unsure about donation. We talked about trust because we know that many communities of color have difficult histories with many of our institutions due to prior mistreatment in research and medicine. And so we wanted to attack trust first, because we think that trust may be an important element in building the relationships that will lead to brain donation in the future. So if you look at the true for most of these, society needs to develop more resources for medical research, regardless of whether people were planning or thinking about donating. They highly endorse that more resources need to be devoted to medical research, that they don't strongly believe that medical research needs to be regulated to prevent harm. They do believe that. But if I volunteered for medical research, I know my information will be kept confidential. They believe that. They believe that medical research will find cures for diseases in my lifetime. In general, I trust medical researchers, even those who said they were not likely. Almost 70% of them said they believe that. And too much emphasis on medical research is likely to harm volunteers. People didn't really endorse that. A few more. I have a positive view of medical research. Even those who were not likely to donate their brains, 72%, over 72% said that they believe that, as well as those who are unsure. So what I'm trying to get at here is the questions that we asked about trust and our concern about trust. It looks like, for the most part, at least in this sample, participants did not endorse that they have concerns about trust in medical research. So that's a good thing. And then when we look at brain donation knowledge and experience, have you ever been asked to donate your brain? No. Have you ever been asked to donate the brain of a loved one? No. Have you heard a presentation by a brain donation researcher? No. Do you know how researchers use the brain for research? No. Do you think that the study of the brain is important for research on AD and other problems? The vast majority of people said yes. Do you know the difference between brain donation for research and donation of organs for patients in need? No. So from this, what we found was that people don't have a lot of knowledge about brain donation. They don't know the differences between brain donation versus donating an organ that's going to go into a living person and help that person live. But they believe highly that studying the brain is important. And in terms of beliefs about brain donation, we found that very highly people believe that the decision to donate one's brain is an individual decision, and that they don't believe that it is a family decision. So we asked both the question, do you think it's an individual decision? Do you think it's a family decision? So 71% say that it's an individual decision, and over 50% say it is not a family decision. And yet, when you ask them, how likely are you to donate your brain after you die? It's about equal percentages if you collapse the somewhat likely and the very likely. It's about 30% of people say not likely, 30% say very likely or somewhat likely, and about 30% are unsure. But when you ask them, how likely are you to donate a loved one's brain after they die, if that was their wish, it's very much, people are very ambivalent. You have the not likelies, which are almost 30%, and then the people who are unsure takes you up to about 50%. So even if your loved one says that they want to donate their brain after they pass away, the family is saying, I'm not sure I'm going to do that, even if they express that. And even though they're also saying that donating one's brain is an individual decision and donating one's brain is not a family decision. So I found that really interesting that on one hand, they're saying it's an individual decision, but once you die, it's going to be up to those people who are your survivors to make sure that your wishes are met, are fulfilled. So what did we find? Few respondents reported knowledge of brain donation, not procedures, not what it's used for. Few respondents have been asked to donate their brain. So that's another thing that we can work on. Most respondents believe that brain research is important, and most respondents endorse trust in research and researchers. But though respondents believe brain donation is an individual decision and it's not a family decision, and yet most respondents, more than half, report being unsure or not likely to donate a loved one's brain, even if that was their wish. So some conclusions in this sample of Black Americans, distrust was not endorsed as a major hurdle. Distrust in terms of medical research or researchers. Black Americans in this sample say that they need more information about Alzheimer's disease as well as brain donation. Brain donation research procedures and processes should be focused on whole family education. And even though most believe the decision to donate one's brain is an individual decision, they still did not say that they would follow through with a loved one's decisions if they pass. So we think that including families in the consenting process is going to be pivotal in ensuring that brain donation actually occurs. So what are our opportunities? So one, even in our sample, we did not have significant participation of Black men. So we have to make that a bigger focus and go to where men are and try to engage them. It's going to be important for us to engage them more, so we really understand about their particular knowledge or barriers that they need to participate more in brain donation. There may be opportunities with regard to those who are unsure. Again, maybe we might not be able to do much with people who say that they are not likely to donate. I don't know. And of course, the people who are somewhat are likely are more likely to donate. But we have a large percentage of people who are just ambivalent, and maybe providing them with information will move them to be more sure about whether they would donate their brain. So I think there's a big opportunity there with the people who say that they are unsure, because they believe they're still trusting in research, they're trusting in researchers. They just may need more knowledge to help them make that decision. as well as just the opportunity to donate one's brain, as Tish was saying, try to make it easier on people to know how to do it and to actually approach them. These are the references for the questions that we used. And then in our acknowledgements, we thank all of those who participated in this study, our collaborators at Case Western Reserve University, Columbia University, and University of Miami. And we acknowledge the support of NIA, a couple of grants, the U grant, as well as an R01 grant, and I'm sorry, 56 grant, and the resources that are provided by Wake Forest School of Medicine to conduct this research. And I thank you.
Thank you, Dr. Van Holt. That's really interesting, and I'm really encouraged by the findings. It feels like we don't have a ton to overcome, but the opportunity for education is a great thing to have.
Right. I think not having to overcome trust, but we're overcoming knowledge deficits. That's a good opportunity. Totally
agree. Thank you so much. Now we'll move on to what we as advocates can do with this information. So our next speaker is Ronnie Tepp of Pyxis Partners. She leads teams tasked with reaching, educating, and engaging underrepresented communities in medical research. Pyxis is a partner contractor for the NIH's giant All of Us study. Ronnie?
Sure. Thanks for having me here. I have a few slides to go through and then really eager for the conversation. So let's get to it. Okay, so I thought I would start by just telling folks a little bit about who I am here representing, which is Pyxis Partners. We are a company located in Washington, D.C. We focus a lot of our work around community engagement. And so I thought I'd tell you a little bit about who we are, what we do, and how we do it. And then spend the rest of my time, which is I think about 3 more slides, talking about how we think about community engagement, how we've done that work in a variety of settings, and how the framing we use can be applied to helping address the problem that Tish so articulately described. So who we are a diverse team of nearly 30 professionals. We are based here in Washington, D.C., but we have staff all around the country. We have experience and expertise in community engagement, advocacy, policy, government relations. We come from the worlds of patient advocacy, the pharmaceutical industry, Congress, the administration, healthcare systems, and nonprofits. In terms of what we do, we are really passionate about what we do. And really, we are all here and come to work every day with a mission, really, and a drive to give voice to diverse communities, those who have been underserved and underrepresented in the healthcare system across the nation, and really work with them to elevate their lived experiences, bring them to the table, engage them in conversations to help develop solutions, and then also motivate them and their communities to participate in research with the end goal of working to advance health equity and to improve access to care. So how we do it using a variety of tools. All of them, I would say, are equally important. So active listening, responsive design, community engaged approaches that really leverage the trust. It says here that we have built, but if I was to write it again, I would say the trust that we have earned with key influencers. We have formal partnerships with organizations all around the country. And I'll get to this in a later slide, but not just the sort of usual suspects, if you will, in the healthcare space. So we partner with social service organizations, faith-based organizations, research, healthcare provider organizations, community groups who help us do the work. And we also leverage the deep relationships we have across government and with the regulatory agencies. Those are important decision makers as well. So that's really quickly a little bit about Pyxis Partners and who we are. in terms of how we approach the work, this is a slide. It's really simple, but it really is the framing for how we think about community engagement. It is the lens through which we approach the work, and it doesn't matter what the challenge is, what the opportunity is, who the client is. We really use this to ground ourselves when we take on a new project or a new challenge. Everything is a challenge in this work in a good way. This, I would say, it's grounded in best practices. It's fueled by the knowledge that impactful engagement requires you to meet people where they are. And people say that all the time. You have to meet people where they are. And most times people are talking about literally where they are, where they live, where they work, where they play. Which of course you need to do. But when we say meet people where they are, what we mean also is where they are on their engagement journey, which is, what is shown here in this graphic that we created that we use, right? And so it literally means, where are you starting the conversation or the first interaction with that community or with that individual, right? It's part of what Dr. Caban-Holt was teasing out in that survey. How much do they know? What is that awareness level, right? Can you skip over that step, or do you need to start there? What is the level of trust? Do you need to sit on that stop for a really long time and earn that trust before you can move on? Or are you in a pretty good place and you can keep moving forward, right? But you can't really skip all the way to the end, right? These are all really important steps. And so you'll notice, if you start with awareness, you move all the way through the steps, you get to the far right, and there's this loop. We refer to it as this retention loop. And for us, this is really important, and it's an important part of the journey, because a lot of times people think, I want to engage a community because I need them to do X, right? I want them to sign up for something. I want them to join something. I want them to enroll in something. I want them to do something. I need them to give me something. It's very transactional. And so the doing the something is the end point, right? For us, that's not at all how we work with community and approach engagement. It has to really be an ongoing relationship, and you need to be there and you need to stay there, and you have to move beyond transactional. And so this retention loop is, showing you that the work doesn't stop, right? It's, in our approach, the awareness happens, the education occurs, the credibility begins to build, the trust is earned, relationships are built, the actions are taken, the individuals move through this retention loop where there's bidirectional communication, relationships are strengthened, there's ongoing engagement opportunities that are identified, and individuals remain engaged over time. And then that, begins to spread. And that is really when you get to impact. So on this slide, we have some key ingredients, again, just to give you a sense of how we approach and think about community engagement on the Pyxis team. They're not in any particular order. You could rearrange them. They're not weighted in any way. I would argue that they're all equally important, and they all need to be part of the vision or the recipe. Well, purposes of just walking you through it, I'll start with the yellow in sort of the understand and go clockwise. But really, they all have to be elements of whatever strategy it is that you're going to undertake. So if the challenge is, we need to increase brain donation, within the Black American community, all of these pieces are going to be really important, right? And so, we're going to need to understand that the cultures and the unique lived experiences of individuals, this is the lens through which they're going to develop their own value proposition. This is the lens through which they're going to determine, on an individual basis, do I really want to do this or not? Do I really want to participate in that trial? Do I really want to make the decision to become a brain donor or not, right? And people need to understand and, look at research like we just heard about, talk to people in the community educate ourselves before we, begin to start in this work. Second, if we keep going around the clock, we're going to need to use a culturally sensitive and inclusive approach, right? This is really critical to address the challenge related to the need to increase brain donation, in this community in particular, but it could be, in any community you're talking about. It's the same concept. Community-specific content can convey the what, it can convey the why in language that's crafted with cultural knowledge and sensitivity that's going to resonate with specific communities. If you have marketing material that is not going to resonate or land with a community, then you might as well not spend time developing it at all, because it is going to not only not move you forward, I would argue it would actually set you back. Next, you need to recognize that there is, and this one is really important, there's diversity not only across communities, but within communities as well. You need to go really deep into communities, sort of understand and get into that concept of intersectionality, and understand what that looks like in different communities. And, how do you, how do you understand it? And then how do you work with it? Because it is real and it's important. And it's sort of I refer to it as like the constellation of factors that go into making an individual unique, right? That's what somebody wants to hear when they're being approached, because that tells them, you are asking me to do something and you understand me, right? You took the time to develop materials that speak to me. And so that's really important. So if we keep going around, facilitating conversations about, in this instance, brain donation in an environment that reflects who you're seeking to reach and engage in ways that are organic to the community. So conversations, another way to think about this, conversations in safe spaces, hosted by trusted community members, right? There is a big difference. If Tish wanted to go to a community to have a conversation about the need to increase awareness about the need for brain donation, there would be a big difference, I would argue, in terms of the results she would get in terms of interest if she went to a large health system and invited the community to come to the hospital, versus if Tish identified a local community-based organization that agreed to partner with her and host the conversation and put their logo on the invitation and invite people into their space, and introduce her as a welcome, thought leader in this space. The outcome, I would argue, would be completely different. And so that really matters. Leveraging the channels through which the community receives information is also really important. So not only understanding what people know, but where is it that they get their information, and making sure that you are able to push out information to them through the channels that they're already plugged into. And then lastly, but certainly not of least importance, being able to identify and then partner with the right influencers and trusted messengers to deliver the information. And those are going to vary community to community. So, all of this takes time, and it takes some expertise, and it certainly takes going deep into the community. But if you can put all of these ingredients together, then the likelihood that you're going to have an impact is, it's going to be a lot higher. So let's see, I think I have one more slide. Okay, so closing thoughts. I thought that I would leave you with some things that are actionable. People are probably thinking, well, so what do we do? Right? I mean, you're talking sort of up here, but we want to know we have a problem right now. What do we do? Tish pointed to the urgency of this. Ronnie's talking about all of these things that take a lot of time. So what do we do? How do we do this? So I thought maybe I could leave you with a couple of actionable tips, and then Tish, I'll turn it back to you and maybe we can talk about some of these things. But a couple of things from some of the lessons that I've learned in doing this work for a while. One is you should not feel confined by having to only go to the traditional stakeholders, if you will, right? If you're thinking about brain donation, you don't only have to look to healthcare organizations or community-based organizations that are considered in the healthcare space, right? My team is doing work for the All of Us research program, and we have built a national network of over 100 organizations that carry the message of, participation to their communities. And that was the first directive I gave to the team, is don't confine yourselves, don't make the universe so small, right? Think about all of the things I talked about on the previous slide. And so, we went to organizations, we went to faith leaders, we went to social service organizations, community-based organizations, and they said, this is incredible. Like, we see the value proposition for our community. Nobody has ever asked us to partner in this way, right? We're not a healthcare entity, right? We're not thought of, to participate in efforts like this. So be creative. Think creatively about those partnerships. They can take all sorts of forms. So really think about what is going to be meaningful, not only to you to obtain and achieve your objective, but what is going to be meaningful to the organization or to the individual that you're asking to partner with, and talk to them and think about, what are the different forms that partnership could take. There are so many different types of ways that you can do engagement in a community. So know your audience, do your research, explore the different types of models, the different ways that if education is the key, if that's the biggest barrier that's been identified, there are so many different ways that you can educate communities. So explore what the different models are and try them out and see what sticks. And then I have 3 more over here on the right. Bidirectional communication, super important. I would say engage the communities early, try to solidify some partnerships early, work with them to help develop the messaging, the content, the assets. They become personally invested, and also the content is going to, it's just going to be stronger. It's going to land with the communities if they help you develop it. Returning value. This one is also really important. Give your partner space to define value, and then be deliberate about returning value to them. Now, sometimes value is, a financial return, but not always. Sometimes it's information. Value can take a lot of forms, and you're only going to be guessing if you don't ask. And so have them work with them to have them define what value could look like, and then try to return it. And then last, and I think this is so important, and it sounds so simple, but just show up and then keep showing up. You have to be there. You have to commit to the partnership, to the relationship, to the community, and you just have to keep showing up. You have to show up even when there's nothing that you need or want, because communities see right through it. Communities, particularly communities that have a history, not a pretty, as it relates to medical research in this country, they see right through it. And, if you are trying to get past or through those barriers, you have to show them that you are going to work differently, that you really are there to be a partner, and, it's going to be a mutually supportive relationship. And so this is, I think, where a lot of times organizations and entities fall short. Like, they go in, they engage the community, they get what they need or they want, and then they're gone. You have to show up, and you have to keep showing up. So that is my final word. And Tish, I'll turn it back to you.
Great stuff. I mean, some of that is like, kind of elementary when it makes sense, but you have to think through every single step of the engagement. For example, when Dr. Caban-Holt was talking about, the problem, is that it's an education problem. It's not a resistance problem or a perception problem that's bad. And so you think, can I skip some parts then? Can we just go straight to education and start educating? And all of those steps and all of those considerations are really key. Here's a practical question. The way things are funded in general, let's say, for example, all of us, or a smaller study, when you say come in and stay engaged, how do you do that when a funding cycle is pretty discrete? It has a beginning and an ending.
Yeah, so I'm assuming that question is for me. So I'll take it.
Yes.
So at Pyxis Partners, we serve as one of the engagement awardees to the All of Us research program. And so that is a massive effort to build a really robust data set to enable research. The program is not doing research on their own, but they're looking to build a diverse data set to enable research on a scale and on questions that hasn't been possible before. And that's only going to work if people agree to join the program and share their personal health information. And so our job is to help the program motivate people to join and stay engaged. And so how do we do that? Well, go back to that graphic that I had up, that engagement journey, and we built a network of trusted messengers. Think about those ingredients I was talking about. And we worked with the program to secure resources to fund. We have formal partnerships with organizations around the country. Like, there is a value to the work that they are doing. And, we worked really hard, to be honest, to secure resources to be able to formalize those relationships, to provide resources to enable these organizations to prioritize and commit to doing this work, because it's constant work, right? It's not just saying, well, can you partner with us and do these two things? No, we want you in the community all the time doing this work constantly. And so we do, there are funding cycles, but we work really hard to try to preserve that funding. And now the catch is, or the trick is, you have to be able to demonstrate an impact, right? The government, right, where these funds are flowing from, has to be able to see that there is an impact from the resources that are flowing right through us to the community. And sometimes that can be challenging because in many of the communities where we're going to, that engagement journey graphic I showed you, it starts with awareness. But honestly, in some of the communities, we are starting like way to the left of awareness, right? We had to work in some cases for 18 months in communities before we were even ready to introduce the program and do the work, start the work with these communities. And so and also in terms of just showing impact, we're talking about things like, well, so how do you measure whether you're deepening trust in a community, right? How do you measure whether someone is now more likely to want to participate in a program after an interaction by a partner? And so, these are not simple things. But that said, there are over 600,000 people who have joined this program now, right? And we are at the 80% diversity targets that the program has set. And so, at a high level,
Congratulations.
and now clearly that is not all Pyxis partners, right, doing that work. There are lots of partners around the country doing the work. But that said, something good is happening, right? And we feel good about the framing that we brought to this effort and the partners and the work that they're doing.
Wow, that's really.
I'd like to add to that as well, or address that question also, because there is that issue of sustainability, that when the funding ends, what is left in the community. So I think part of it is when we are writing our grants, we need to write in funding to do community engaged work, recognizing that engaging communities that are not typically engaged takes time, but it also takes funding as well. So from the policy perspectives, getting policymakers to understand and getting our grantors to understand that we have to put that in our grants in order to connect with these communities. But also in terms of sustainability, that's where doing things like our questionnaires, and then our next thing will be focus groups, is hearing what is of value to that community, helping to provide it so that they have ownership of it, so that when we do can't be there, all the time because of funding, that they have ownership of it. And this is important to them. So they're going to continue to meet or encourage people. So I think that's where we have to make sure that we are engaging them about the aspects of this work that are important to the community, so that it's theirs. So that when we're not there, they're still there, and this is still important to them.
Yeah. And I would say the other thing is, when you're in the community and really connected and you're in there for the longer term, for example, in our work, we may have, say, 10 organizations in a community that we're working with, but those 10 organizations, even though they're from the same community, they may not have a history of working together, right? And we are the ones who have brought them together to work on this project, right? And in doing so, they have then identified new ways to work together on things outside of this project, right? That are going to help them build capacity with other programming, right? And so that's like a benefit outside of the scope of, why we brought them together in the first place. And so that was part of what I was trying to get at, which is, there is all sorts of value. And sometimes the value is beyond like the specific project, that very transactional, like initial conversation of why should we partner, right? And we've seen that happen in a number of places.
Yeah, definitely. I mean, the idea of a gift card for filling out a questionnaire, I totally get, and it's the right amount. But to really identify beyond that for an organization, what are you trying to do here? And what could help you with that we might be able to provide is definitely a very fair question. What sort of bi-directional communication has worked best in these communities? Dr. Caban-Holt, I was thinking about you.
So I think for us, this probably isn't a quick example, but so it has been important for us to certainly to reach out to, different groups. So for example, we have a group of faith leaders that we actually engaged in 2019, right before COVID, had no idea COVID was happening. So that when COVID hit, we were already a trusted resource. And so we were able to hear some of their concerns about, at that time it was COVID, and what was going to happen to their congregations and to their churches. So I think that it's important to hear it. And then we created education and webinars that address things that were very specific to what they needed and what they were asking for. So I think you have the relationship, and then they come to you as the trusted source. You need to respond to them in some way. So we did that through webinars, we did that through town halls, but it was we did a questionnaire about how people were faring during COVID that was in response to something that they wanted. So I think that's very important, that not only do you engage them, hear what they want, but then you must do something to respond so that you're helping to meet a need that they are expressing.
Gotcha. Good call. So the other thing that I struggle with is I kind of feel like for those of you who have been recruiting people for studies, by comparison, is brain donation a lighter lift? In some ways, I kind of thought it was, because you're not asking somebody to go back every month and give blood or be questioned or whatever. But there's a certain, because of what you found, Dr. Caban-Holt, with it was fascinating to me that people say it's an individual decision, but I'm not sure I could do it to somebody else in my family who says they want it. So at the risk of oversimplifying, and I love using this clinical word, there's a certain hinkiness about this whole idea of taking somebody's brain out. They kind of persist a little bit, maybe more in communities of color. What do you think?
I'm not sure if it's any more in communities of color per se. I think it's a general feeling about that one's brain is just different than than other organs. You can take one's heart out and give it to somebody else and it'll continue to beat. And so we're just now really getting to talking with this with the community about brain donation for this study. In prior work that I did, it took some time. Sometimes, and I think that's something that Ronnie had brought up before, building these relationships take time. What are you going to do with my brain? Explain all this to me. Do I trust you to have this very, important, this very important thing? And so it may be that people have to be approached once and then twice and then 3 times. I mean, I think that's the thing about about trying to approach people, is that we can't put the hard sell on them. It may take some time for them, and it may require multiple approaches.
But that shows a commitment too. So I get why that's important. Well, we're coming up on the hour. So any closing thoughts? Let me just tell you this. I really appreciate you two being here today. I feel like we got some good practical advice and some learnings that I was thrilled to find out. I feel like I could make a better plan than what I was thinking before, because now I know what we face and I got some pretty good ideas about how to do it. We're fortunate in that there are people like Pyxis partners, and I'm sure there's others out there that are making the on the ground connections for those of us who can't afford to go do all that. So I appreciate, both of you helping me understand how to do this better.
So I just want to say thank you, Tish, for all that you're doing and for bringing us together. It's, a super important project, or super important effort. The opportunity is just tremendous. And, both in terms of the science and in terms of, being able to get in front of communities and show them the opportunity that they have to, help advance. So just thanks for asking to share.
You bet.
And I thank you as well for giving us the opportunity to really highlight the importance of reaching out to communities that are typically underserved in the medical system and the research, because we got to engage everybody. We got to be inclusive if we really want to make strides in understanding these diseases of the brain.
Totally agree. It's not complete science until we get there. So, okay. Thank you so much.
Thank
And
you.
everyone who joined us. Okay. Bye now.